Good evening, good afternoon, and good morning. This is the 1735th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. K. Srinivasan. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money, and you can share it with your friends, whether he be or she be a homeopathic lover or a homeopathic doctor or a student. But or maybe the purpose of the forum is to take homeopathy to every home around the world. We have presentation from 65 countries, and eminent personalities and doctors have made brilliant presentation in this forum. And today, let me introduce the guest of the day, Dr. K. Srinivasan, MD. He is a visiting professor, Shivaraj Homeopathic Medical College, Salem, and is a speaker at various conferences in Canada and India, as well as other part of the world also. He is a practicing at Chennai and Salem, having excellent practice, a classical practitioner, always uses repertory for easy method of treatment, and is having more than 22 years of clinical experience. I have presented some of the brilliant papers in this forum and has narrated about the repertory and how to use the repertory in choosing medicine, like everything. So many brilliant presentations in the past, and today Doctor will be discussing about another important subject, that is Prasad. Nobody know what it can be, but everybody can guess what it may be. Okay, we proudly welcome the guest of the day, Dr. Srinivas. Welcome. Sir.
Well, thank you very much, sir.
Yes.
One Dr. Veerabhadra Rao, he was basically an ENT surgeon and worked as resident medical officer in Guntur Medical College. He came across acupuncture, he explored acupuncture learning and practice. Then he came across homeopathy. He explored learning homeopathy and its application. He did his MF from London from Hyderabad. Then he started teaching and training students across India. I first attended his session in 1999 February in Pondicherry. Our postgraduate batch went to Pondicherry from Maharashtra, attended his session. Then gradually my interaction with him increased. He started teaching various aspects of theoretical and practical homeopathy. Over years of interaction, we learned a lot from him, and also he was constantly exploring to improve the result percentage, to give more comfort to patient, and on principle. And one such idea he read thoroughly, applied, and then started teaching is using Schussler's biochemic tissue salts on the basis of sun zodiac sign. using Schussler's biochemic tissue salts on the indication of using sun zodiac sign. In my understanding, astrology is absolute mathematics. There is nothing called I believe or don't believe. Not only in astrology, in any field of life, there is no question of believing, not believing. If your heart says, take it up, take it up. See the depth and width of it, apply it, test it. Say with unprejudiced mind, and the truth unfolds in front of you. Whether we see that truth or not, that alone is the question. No question of believing or not believing. Astrology is mathematics. Most accurate the calculation is, accordingly will be the outcome, predictions. Astrology broadly can be divided into gross astrology, micro mini astrology. Like people can be divided into 12 larger groups, then 27 smaller groups, and still further, and ultimately it can come to an individual effect also. Similarly, homeopathy can be broadly divided into gross and micro mini. Gross homeopathy, one most established example, genus epidemicus. Where largely there is no time, manpower, skill to find out the individual remedy, but we have to save life, give comfort to patient, and prevent also. So like gross astrology, one example practical is genus epidemicus, which is gross homeopathy. Micro mini astrology is comparable to highly individualized case taking, finding most similar remedy, potency, and dosage, and thereby effecting a rapid, gentle, long-lasting, deep and wide result. So gross astrology is equal to gross homeopathy. The example is genus epidemicus. Micro mini astrology is equal to micro mini homeopathy, that is individualized remedy, similar remedy producing rapid, gentle, long-lasting relief deeply and widely. So combining gross astrology and gross homeopathy, we can roughly call it as birth salt. The word birth salt is coined by Veerabhadra Rao sir. Maybe we have to search internet to check whether there is precedence. Rao sir taught us somewhere in the year 2007-2008. And 12 sun zodiac signs equal to 12 Schussler's biochemic remedies. If we go to internet or any zodiac sign, sun zodiac sign books, there may be smaller differences in the dates and zodiac signs, but it's okay. We take one example and apply it. Then if it draws your attention, you can refine it, become more sharper. So Aries, these are available in internet. Need not take down notes. For people born on March 21 up to April 19th. Some websites, some books give a date overlap. So those are also there. And we have discussed over overlaps and to find solutions as well. Then Taurus, April 20 to May 20. Now, every country has their own zodiac sign calendars. And in Kerala, they have a star, which is, and in Tamil Nadu and most part of India, star-based and moon-phase zodiac signs. What is largely practiced across the world is sun zodiac sign. So the list is on basis of sun zodiac sign on sun calendar. So sun zodiac sign Gemini, birth date for people born between May 21 and June 20. Sun zodiac sign Cancer, June 21 to July 22. Leo, people born on July 23 up to August 22nd. Virgo, people born on August 23 to September 22. Libra, people born on September 23 up to October 22nd, both date inclusive. Scorpio, October 23rd to November 21. Sagittarius, November 22 to December 21. Capricorn, December 22 to January 19th. Aquarius, January 20 to February 18. Pisces, February 19 to March 20. If some of you are not familiar with this, you can write down or you can take photo of the screen. Keep it for reference. I request Dr. Danesh to post the Word document in the group and everyone can view. I will share it as the session is over. Dr. Danesh can share it in the group. If you want, you can take a photograph also and check according to this list, what is your sun zodiac sign of your loved ones, your friends, your acquaintances. It is very interesting that you see something new, it attracts your attention. Don't bother whether you believe it or not, whether it is right or wrong. Put it to test. See what is happening. Then you decide whether it is truth or not. No prejudice. Simple point. So take a photograph of the screen. You can write down or type down. What is your sun zodiac sign? What is your loved one's zodiac sign? Your spouse, your father, mother, your children, your brother, sister, your close friends, anyone for that matter. And these are immediate experimenting tool, no? Instead of giving to your patients, you can give to these people and see whether it is working or not and whether there is any truth in the idea. So they are most immediate guinea pigs, to call it funnily. We are serious enough and cautious. We are not loose. Now, what are the 12 biochemic salts? According to Shastler, there are later experimentation which had shown many as chemistry advanced, as technology advanced, there are more additions. These were 12 fundamental salts as listed by Shastler. Calcarea fluor, calcium fluoride, Calcarea phosphorica, calcium phosphate, Calcarea sulf, ferrum phos, calimur, caliphos, calisulf, magphos, natrum mur, natrum sulf, natrum phos, silicate. You can take a photo of this screen as well. Keep the list ready. And the next list is which zodiac sign and what is the Schussler's salt for it. The corresponding Schussler's salt. Let us see that. So 12 salts, calcarea fluor, calcarea phos, calcarea sulf, ferrum phos, cali more, cali phos, cali sulf, mag phos, natrum more, natrum sulf, natrum phos, silicea. So 12 Schussler salt and 12 zodiac signs, sun signs. Then we will go to the next point. You can take photograph of this screen also. So this is the list. These are available in the internet as well, but for quick reference and what we see in today's class, take it up. So Aries, the sun zodiac signs are arranged in one order and the corresponding birth salt is given. In the previous list, you saw in the alphabetical order the Schussler salt. So it is not an alphabetical order of sun zodiac sign and alphabetical match of biochemic Schussler. So carefully look at the list. Take a photo for reference also. So Aries, birth date March 21 to April 19. The corresponding birth salt is Caliphos. So how they came to it is an academic question. We will use it from clinical perspective. So we will not go into that historical aspect, who came upon this and how. All that is more academic. You can find it from the internet. We will see it more from the clinical standpoint. How to use it and what for what. So Taurus, natrum sulf, Gemini, Cali more, Cancer, calcarea fluor, Leo, mag phos, Virgo, cali sulf, Libra, natrum phos, Scorpio, calcarea sulf, Sagittarius, silicea, Capricorn, calcarea phos, Aquarius, natrum more, Pisces, ferrum phos. So I think this list is good enough to keep on a clinic table as a ready reference and use it on indication when there is need. So we don't use it only because it is on birth date. We will see how to use it more logically. Let us see. Where all this list or this kind of prescription can be used. Where to use it? Very common indications I found this effective. I put my best effort in taking the case with location, sensation, modality, concomitant, physical generals, mental generals, past illness, family history, nature of the person, life space, all best efforts the doctor has taken. But patient is suffering, but every symptom is very vague. We are not able to clearly point out this is the characteristic totality, this is the reference, either from Materia Medica or from repertory. So I am not able to conclude, but I want to help the patient. Individualizing characteristic symptoms are not yet available. So this is one indication where if you are sure about date of birth, you give that birth salt, trustless salt, that will help the patient. Patient will rally from sickness and suffering towards relief. So let us be careful what is possible through such prescription. Second, patient is still in the state of indisposition. Symptoms are vague, but still there is suffering. No clear-cut single totality. You use birth salt depending on the basis of date of birth. Then, acute situations. Fever is there, cough is there, stomach pain is there, severe body pains or joint pains, all acute, but still, as such, no clear-cut totality, and you don't want to blindly shoot. I want to give a potentized remedy on basis of either one Materia Medica approach or repertorial approach, but I want to help the patient. Symptoms are not clear. So this is third situation where birth salt will be a great help. Then, I am not well, I am a patient, I am a layman, and I have certain suffering. Either I was traveling or somewhere in the late night and I am not able to reach my doctor, but I have my stock of birth salt with me. I tried to reach out to doctor and say, I have first aid kit with me, or my child is not well, my spouse is not well, some family member is not well, or we were traveling as a group and one group member is not well. I thought I can talk to my doctor and find out a remedy, but I couldn't reach the doctor. But I have at least the 12 shoeless salt. Can I try it out? Yes, on basis of the date of birth of the suffering individual. Yes, that will help. Then, the case is very systematically taken, repertorized or Materia Medica approach, gave the similimum, and which worked partially, then no help. Then I tried nosode, that also helped partially. Then there are few lingering symptoms which is not at all going away. Whatever potency I change, whatever medicine I change, whatever dosage adjustment I do, most of the symptoms are going, but 3 or 4 lingering symptoms are there, which is not going by lifestyle modification, meditation, music therapy, all other things. That is also not helping. Patient is having few symptoms, and it is not due to any exciting cause, not due to maintaining cause like diet. Sometimes it could be due to the allopathic drug which patient is taking, anything like that. So all that we carefully worked out, but we are not able to help the patient. One possibility could be for a solution is using the birth salt. One of the possibility. So there are lot of reasons why some symptoms linger. So we calculate all those things. Maybe you have to change the remedy, you have to change the potency, you have to adjust the dose, you have to switch potency, you have to use a nosode or sarcode or whatever. You have to change the lifestyle diet of the patient, music therapy, yoga, meditation, all that, counseling. Nothing is helping. Then one possibility is birth salt. So these are options, and one is birth salt. Then a lady is in the stage of labor. You want to help her. Like in the hospital, the doctor, the gynecologist, obstetrician is willing to support the patient with homeopathic remedy or whatever. And expert homeopathic doctor who can give accurate single remedy in potency at that time is not available. Still, I want to help. What is the possibility? Birth salt will ease the labor, make the process quite smooth. So it will help at that time also. Then after delivery, lot of things happen in women's body as well as in emotion. So I'm telling all these related to body, but birth salt will work in emotions also. It comes as the last point. So postpartum bodily complaints and emotional support. Then during lactation, birth salt will be a great help. Then in cases of medically manageable emergencies, which is within your purview, and at least it will act as a tide over. Supposing a patient is having an anginal attack, you are an expert able to handle the situation with potentized remedy and save the patient and life. Fantastic. That is choice number one. If that is not possible and you are not confident, either medicine is not available and you want to ambulate the patient to emergency room, and we have time till then, can I give birth salt and see if that helps? Yes, that helps. So this is emergency situation, support remedy, either till you get a best skilled homeopathic doctor to give homeopathic remedy potency at that time and save patient, or till you ambulate the patient to emergency room and give support measure and sustain life. So in that time also, the birth salt will act as a support remedy. Then strong emotions and its effect. Patients will throw up strong emotions, and so much pour out is there. Sometimes you are baffled, like which one to give importance and what is the remedy. If I look at one component, it looks like one remedy. If I look at another component, it looks like another remedy. If I put together, then it looks like third remedy. I am confused, not very sure. So emotional upsurge, one, and sometimes the emotion is either still there or it is gone, but now it is reflecting on the body, the effect of emotion on the body. Okay. And there also the birth salt remedy will come. So the question is, where the date of birth is available, when patient doesn't know, there is no question. Even then, there is one place in Tamil, of course it must be there in all parts of India. In Tamil Nadu, there is one place called Vaidhishwaran Kovil, where you give the fingerprint of your thumb. You go there, there are people who have palm leaves where the astrological predictions are written. They will see the fingerprint and take those palm leaves and cross check with you, like, because they also want to know. When patient comes to us and we take the history, finally some 4 or 5 remedies come. We ask a differentiation question. Do you have this? Do you have that? Don't you have this or that? We differentiate and come to one remedy. In the same way, if you go to Vaidishwaran Kovil with the fingerprint, there are many people who are 60 plus from a smaller place, or father died early, mother died early. We lived with our relatives, and I don't know my date of birth. Whether there is any solution? Yes. You give your fingerprint, go there, they will cross check, and then say, for example, they will ask you, do you have 2 brothers? Then does your father's name start with letter A? Is this your spouse name? Is this your present place of living? They ask cross-verifying question, and then they select what is your date of birth document from that palm leaf and read out your astrological predictions, past, present, and future. And they will be able to tell you your date of birth also. So that is one solution where if you're curious enough to know, that solution can be taken up. And one more thing that happened in place where I practice, for various reasons, they change their date of birth, and when for school admission, for joining work, and for various reasons, they will change the date of birth. And when we ask them, they will tell that changed date of birth. And so whenever I ask patients, I always ask, what is this your date of birth according to your horoscope? Then some people rarely smile and say, no, no, doctor, it is according to school certificate. My original date of birth is this. Then we take that one, which is original, and find out using the list above what is the birth salt for that person. So indications again, when even with doctor's best effort, clear totality, similar remedy is not available. In indisposition, you can use it. Acute situation, no clue for single clear remedy. Doctor is not reachable. After similar remedy and no-salt therapy, some lingering symptoms are there, and one of the option is bath salt. And to ease the labor, to manage postpartum situations, and during lactation. So to improve the milk quality, to improve milk secretion, to improve milk quantity, and pain in the mammae, all the mammary symptoms will go away with birth salt also. Support remedy in emergencies, and to regulate strong emotion, to calm down the patients, and sometimes even to remove the effects of such strong emotional storms. Okay, so that is most commonest indication or situations in which I have used birth salt and found good result. So I don't claim that it has cured the patient. That is rarest. No. In all other situations, it has eased the situations to a greater extent, and it is a good help when professional skilled medical help is not available for various reasons. Okay, so these are most commonest things. And now the potencies commonly have used is 3x, 6x, and 12x, not beyond that. Because if I use beyond it, I used in very, very few cases. But if I go beyond it, for reasons unknown, they tend to go for some proving symptoms. Like some of the remedy symptoms come up, so I stopped using it. I am not, I am reluctant. Maybe I would have used it in more number of cases and produced good effect. But seeing some early subtle changes in the patient, I confined myself to using 3x and 6x and 12x and not beyond it. So maybe I have to put it to test and then say definitely no problem, you can use it 12x or beyond. So my application is largely 3x, 6x, and 12x. And the dosage that helped largely is depending on the age, 2 tablet, all are 1 grain tablets, not 3 grain or 6. Larger tablet, all are smaller tablets. 2 tablets per dose, 4 tablets per dose, 6 tablets per dose. So all these things, if you have already used Schussler's Biochemic, you can use according to your pattern of practice and your convenience. There is no hard and fast rule like if this is the age, this is the condition, this is the potency, this is the number of tablet. No tabular column. I am giving a wide range, an elastic range, and you can navigate from one to the other. Start with a lower one, say 3x, 2 tablet once a day. And if patient tolerates it better, then switch up to twice a day, thrice a day, or 4 times a day. Then use 6x, then use 12x. So start with something smaller in potency and dosage, and then step up gradually. be more elastic. There is no hard and fast rule. So 2 tablet, 4 tablets, 6 tablets per dose, once, twice, thrice, or 4 times a day. They can chew it or swallow with water. If you are giving for still smaller children who have not yet learned to chew or swallow, make it a powder, mix in milk, water, or honey, whatever, and let the child swallow it. So those smaller changes you can do by yourself. Or patient is non-cooperative. Say, for example, a lady calls and says, "Doctor, my husband is an alcoholic. He is not cooperative for any treatment." And we take the best effort to elicit the case, even in an alcoholic. Instead of trying any mother tincture, where also you can do with sharp indication, not favorite remedy. But the spouse says, this is his birth date, and then you try out the birth salt in the patient's alcohol itself, or without his knowledge, in the food and drink the alcoholic person takes. This will help reduce the alcoholic intake, and then symptoms become more clear, patient becomes more cooperative. You take individual case taking, you give the individual remedy, and the alcoholic bad effects and the alcoholic addiction goes off. Okay, so these are areas where this works, and the maximum period I have tried is for 6 weeks. Then any of these things will happen, because things will change. Either the lingering symptom will go off, or symptoms become more clear, and I form a totality, give indicated remedy in potency on that basis, then patient improve. So the maximum period I have given is 6 weeks. Up to that I have changed. Okay. And some of the interesting experiences I had, here you see natrum or Aquarius patient, they are more prone for love failures. So if any of you in the group, or you know your friend or spouse or family member or your favorite patient is Aquarius, and you are giving your best remedy and not working, and the love failure history is there, you try out natrum more. So, when I see it is this way also. Sometimes patient don't tell what has happened in the past. Then we ask, what is your date of birth? And they say, oh, this. Then we say it is natrum. Then we ask them, are you in love with some person of larger age difference? Or are you in love with some married man? Or you had a strong history of love failure? Doctor, are you an astrologer also? So many times such interesting things had happened. And when patient comes with a birth date of Sagittarius, and we ask them what all the past illnesses you suffered, they say, no, 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 doctor. Then we ask the date of birth. They say, and we found it is Silesia. Then we ask whether you had any suppurative history anywhere in the body, whether you met with any accident and you had a fracture. Wow, how do you know? So we know from Materia Medica, and we corroborate, and that brings an instant smile in patient's face. And then they recall, yes, now I remember I had a bad tooth and the gum was so suppurative, I suffered a lot. And see, like these corroborate things. So this way, what Materia Medica we know, it very often matches with the birth salt, the date of birth, the sun zodiac sign, very often. Not always, but quite often. So one or two most common favorite indication of these birth salt or these remedies you find in the patient either in present or in the past illness. And one more thing, all of you who are Pisces as your zodiac sign, any of you whose date of birth is between February 19 and March 20. Please unmute and tell me whether you are Pisces. Unmute and tell me. Born between February 19th and March 20.
Please raise your hand so that we will allow you to unmute. Otherwise, we will have to go for the option. Everyone can unmute.
Any Pisces? I have one
Please raise your hand.
shocking news for you.
Nobody is raising the hand.
Okay, sir. So what I did was, as soon as Rao sir introduced this method to us in our seminar, the only thing is put it to test. Huh? There is no belief or disbelief, no prejudice. Apply. So what I did was, from that day onwards, for all my patients coming to my clinic, I started asking their date of birth. So patients are happy that doctor is asking something new, and in the heart, they knew that this fellow is taking one more effort to help them to cure their disease. So my intention is to help them. So these patients quickly sensed, and everyone were so cooperative. And what I did was, say roughly 12 zodiac signs, and in each zodiac sign, 50 patients. So 600 patients. 600 patients and 50 patients under each zodiac sign. So I applied to everyone and then followed them for 6 months. And I constantly was talking my learnings with Veerabhadrao sir. He was so excited, and he told Srinivas, you are one person who put to test everything I teach. And then we interacted. He told what all the points which is already reported in literature, what all the points he found out, and he also acknowledged points which are not there in literature and not observed by him, but I observed and reported to him. So I came across lot of new points by my application, which is not in literature and not observed by Veerabhadrao sir also. So it was very, very, very interesting thing. And one interesting point was, those people who are born between February 19th to March 20th, whose sun zodiac sign is Pisces, and the Shushler's salt is Ferrum Phos, if they do blood donation, they take more longer time to recover from their blood donation. The number of vague symptoms they develop post-transfusion is more compared to any other zodiac sign person. If other zodiac sign person develop one symptom post-transfusion, like vague myalgia, mild headache, I feel weak, I feel drowsy, I feel indisposed to talk or life, lack of interest. Like this, if anyone is told post blood donation, not transfusion, receiving, post donation, the Ferrum Phos people develop 10 symptoms. And if other zodiac sign people recover in 2 weeks or 3 weeks, these people take 2 months or 3 months. I'm telling on a comparative larger scale. So they develop more lingering symptoms and they take more longer time to recover. And interestingly, their serum iron levels is usually low, whether they have given blood donation or not. These people's serum iron level is comparatively low than other 11 zodiac signs. And if it has dropped after blood donation, it takes longer time to become normal, even if they take oral iron supplement, dietary iron supplement, or injectable ions. So if your epicene, be careful that you don't donate blood hereafter. You take longer time to recover, and it needs more effort on your part as well as doctor's part to recover. And interestingly, this is one side problem. I have to find out a solution also. Interestingly, many of them recovered quickly by giving ferrum phos in 3x, 6x, and 12x. So we have problem identification and problem confirmation and solution for the problem and prevention measure also. So all in one string: problem recognition, confirmation, solution, and prevention. Okay. So similarly, natromorph people, we do their electrolyte level. Majority of them have imbalance in sodium and chloride in their electrolyte blood test. And they are more prone for emotional problems, and they recover generally with natromorph 3x, 12x, 6x. And sometimes we can jump directly to potency and make them all right as well. Okay. So this is broadly about the concept of sun zodiac signs, role of astrology, Schussler biochemic salts, and how we can clinically use the sun zodiac sign and Schussler biochemic salt, and what are the common clinical situations where you can use these, what is the potency and dosage, all in summary. So you can discuss, try it out. So don't have prejudice. This is not homeopathy. Astrology is humbug. I don't agree. All okay. Put it to test. Honestly, with an open mind and critical observation. With absolute unprejudiced mind, approach the issue, see it for yourself. Questions, sir?
Yes. Thank you, Dr. Srinivas, for a beautiful session in this evening, entirely different session indeed. And really, everybody loves it with. Sir, can you stop screen sharing? Yes. Really, nobody really knows that what is to be discussed about worth salt. Everybody thought that it may be about, sometimes it may be about calcarea, carbon, netramore, like that. But you're talking about these specialized remedies and how it can be compared, connected with these astronomy. And I have, let me say a few words, because when I have some problems, one of my senior took my class, and he find me that he told me that you may take a calcarea salt for you for your disease, and particularly he suggested someone, unfortunately for me, for that particular problem. But after going through this session, I am a Scorpio person, but I have seen that your medicine there serves a calcarea self. Yeah, though it come accidentally, but I was searching what medicine can be there in that way. But to my uh, totally, I was really surprised to see such a medicine there. So there is something in it. That's the reason why that came out, because I am a hot person as well as a cold. As I have some characters of chilly nature. So when usually the medicine come to can be a hot and chilly remedy combined together, and that's why calcarea salt come into the picture. But here in astronomical your analysis also, that remedy comes for as my remedy. As this is really a surprising thing. Anyway, this is the time for discussion, and those who want to make any comment or want to have a question, you can raise your hand so that we will allow you to unmute yourself. Yes, Dr. Rampares also want to speak something on that. Yes.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. Sri SRINIVASAN, sir. Very nice presentation. This biochemic remedy according to social art and according to astrology and month. So biochemic remedy according to month, January, February, March, April, according to month. It's the deficiency, according to deficiency, astrology, uh, due to astrology.
What is your birth salt, sir? What is your birth salt?
In according to diet भी एक मंथ के अनुसार हिंदी में एक कहावत है, चैते गुड़ बैसाखे तेल, चैते गुड़ बैसाखे तेल, जेठ में महुआ आषाढ़े बेल, सावन दूध न भादो मही, क्वार करैला कार्तिक दही, अगहन जीरा पूस घना, माघ में मिश्री फागुन चना, इनका परहेज करे नहीं, मरे सही तो परे सही।
वाह वाह वाह।
तो यह परहेज है अकॉर्डिंग टू बायोकेमिक थ्योरी। डिफिशिएंसी अकॉर्डिंग टू ग्रह, सन, मून। तो डिफिशिएंसी तो यह जो है हमारे शास्त्र में। तो बहुत बहुत धन्यवाद श्रीनिवासन सर, आपने एस्ट्रोलॉजी विद एस्ट्रोलॉजी बिल्ड किए। वेरी वेरी थैंक्स।
Dhanesh sir, if there is any question in the chat box.
Let me check. Can I bus? Yes. Where can we learn more about astronomy and homeopathy? Any book or videos? Do you have? Do we have any books in reference in Vedic astrology, birth chart, which is highly individualistic?
No, that much I have not read, sir. The question is too sharp.
Yes.
That Vedic astrology, homeopathy, I have not read.
Okay. Can this birth salt be given along with the constitutional and potentialized indicated remedy?
The practice I only did, I have not combined both. I gave one at a time, evaluated what is happening with that either potentized remedy or the birth salt, and then decide what next. So my experience is giving either this or that only. So I cannot say whether that can be given together. I don't know.
But frankly, to my experience, what I do is while giving constitutional medicine, whenever we used to give some flagship dose, instead I used to give some biochemic for them. So naturally, it can be if you give the same astronomical medicine, that may be a complement that may work in tandem, or sometimes it may be work as a complementary medicine.
Possible, sir.
That's
I
my
cannot
suggestion.
speak from direct experience because I have not done it largely.
Dr. Govindraj, do you want to talk? Please unmute yourself. Dr. Archana, do you want to speak? Dr. Harrikan, sir, do you have any suggestion or do you have any experience?
Hello.
But yes. Yes,
Hello.
sir. We can hear you, sir. Please continue.
Actually, see what doctor said is maybe correct. Maybe correct because it is an occult science. We have no direct proof regarding this, but we can try the efficacy with the 12 zodiac sign and 12 tissue remedies. One basic difference is that we believe, actually, we believe and practicing not the zodiac signs, but we are in Kerala, we believe in nakshatras. That means, I think we have 12 nakshatras that from starting from Ashwati, Bharani, Kartika, likewise. So I think this is the most precise method. What somebody research in this field may show and find out some wonders. I think it's so. Anyway, what you doctor said may be correct, but on practice only, we can say whether it will do good or not. Okay, doctor, very good. See, something new. You said something new. And I have a book with me in early my practice. I think Dr. One Agarwal, or I'm not remembering, in my library, that book is there. That is with me. And I read it, but I don't know how much efficacy it is having. Okay. Thank you very much, doctor. Congratulations for your effort.
Thank you, sir. Sir, I think time is up.
Yes, now I invite Dr. Leta Manoharan to say a vote of thanks to the session. Please unmute. Please unmute. Unable to unmute. Okay, no problem. Yes, Dr. Ambaresh, sir, you can say the vote of thanks.
Dr. SRINIVASAN, excellent session. behalf of IFPH whole team, very thanks.
Thank you, Dr. Ambaresh, sir, Dr. Srinivas, and those who attend the session in this evening. And tomorrow we will have a session from Dr. Rashmi Shukla, and she will be talking about mysteries behind homeopathic drug dynamization. Mysteries behind the homeopathic drug dynamization. With that, we come to the end of the day, 1735. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.